Back.
Hi, thank you for having me.
Yes, of course. How are you doing today?
I'm doing well. What about you?
I'm good. Thank you for asking. I know last week we started discussing about some of the things that brought you to therapy, and we also went through some questions about your life, what's been going on, what happened in the past. And you mentioned that you were referred by a nutritionist due to her noticing like some eating patterns or behaviors that caught her attention, and she wanted you to maybe uh, deeper on that. So I wonder if you could tell me more about that today.
Okay. Let's see. Before, like years before, I used to smoke cigarettes. I will say like some packs a week, maybe one or two. But I stopped doing that. Let's see. I stopped doing that, and I think I changed that for eating. Like I think smoking helped me with anxiety. But I think after that, I kept experiencing it and I changed smoking for eating at this moment. And it's actually taking a toll on me as well. So the nutritionist told me that I could benefit from therapy in that way to help me to cope with anxiety while I'm also figuring out how I feel about or what my current health.
Yeah, that makes sense. I wonder when you say like it has taken a toll on you, what does that mean for you?
Um, I mean, there's like I usually have like reflux. I didn't have that before. I understand as well that it can be a consequence of heavy smoking from years. But after I quit, I still have reflux, and she told me it might have something to do that I usually eat later in the day, like in the evenings. Um, so I don't know. It feels like there's a lot of things going on. I can't really identify which one, or it's just to say that I think for myself that I eat a lot in like late hours or not so normal hours. Sometimes I think it has to do with anxiety, and other times I think it's just just the time that I have available or the time when I'm actually feeling hungry. But it's not only hungerness, it's actually also anxiety.
Hmm. When you talk about anxiety, um, do you happen to relate that to any type of situation or
Well, to me, it's like I work during the day. Um, I think it has to do something with the things or of the thoughts that I have when I'm not working, when I am on free time, and I feel like there's a bunch of stuff going on in my life, and maybe I don't know how to solve them right now. Because of that, I feel like I numb myself with eating, maybe to just to have something else to do other than just thinking about my phones.
so it sounds like eating gives you like kind of like an outlet to what you're going, what you're feeling at the moment.
Yes, I have also been told that by some friends, um, and that they have because I talked to them about my problem, and he said, "Well, it's a possibility that this is the reason why I do what I do."
What do you mean by that?
That I have like this reflux problem might come from eating too late, and eating too late might come from having this anxiety episodes in the nights.
You were saying that there were some things that were maybe difficult to deal with, and that brings you to then like have this eating. Can you tell me more about those situations that may be difficult?
Well, to me, it's like I also have a kid, and I'm a single father, and I believe that because I have to take care of him first. I think that's what all parents do. I'm taking care of him first. And after that is that I feel like I have the availability or the time to take care of myself. So, for example, I eat out non-regular hours, like very early in the morning, then I have to go to work, and I have to take care of the kiddo. And then after I put him to bed is that I feel like I can eat again, and I feel like I have the proper time to make myself a meal. But that also clashes with the time that I have to sleep. So, but it's, it feels like the only time I can actually eat the way that I like.
It's like it's difficult to take care of him, to take care of you while taking care of him.
Well, I'm not sure if it's difficult. I think it's priorities for me. Like it's a priority for me, and then after all his things are done, then I have time for me.
Okay. So the priority will be him.
Yeah, of course.
And then what comes after that? What other priorities you have?
I mean, I need to keep a wage some way, so I think about, I hope that there's nothing that's happened at my work, so I have my job, so I can keep my job. And of course, there are also the bills coming from having a kid, which is not cheap. Uh, but yeah, I feel like I don't have enough time during the day to to have a proper maybe nutrition to say in a way.
So it sounds that it's more than dealing with difficult situations. It's also about your schedule and some of the other things that are going on in your life and make it sometimes harder to have like a different routine around eating.
Yeah. I think it was easier when I used to smoke, because with cigarettes I kept like a lot of energy. So even though I had to take care of a kid, um, I also did have time to to be awake a little bit longer, having a little less sleep. But since I'm not doing it anymore, I feel like I don't have enough energy during the day to take care of myself and take care of the kid at the same time. Uh, so as he is my priority, I try to do what I can in a small time amount of time that I have for myself.
It must be really difficult sometimes.
Yeah.
But I can see that you really care about your son, trying to do everything to take care of him. And you're here today. So you're trying to learn how to take care of him.
Yeah.
So if we think about that, we stay with that feeling of you learning how to take care of you. What could be something that you see or that you expect getting out of this process or learning out of this process?
Well, I'm actually not sure. I think that this is my first time doing this, so I think that there's some kind of an answer or maybe way that I don't know about how to how to maybe manage my time, maybe find the availability or a solution to my current problem, which is like um eating in at this non-regular hours. But I don't feel like I can find a way to manage that by myself.
So we can figure that out together, definitely. From what you're saying, what I'm getting is, and correct me if I'm wrong, that you want to know how to manage your time. That's one of the things that you want to get out of it.
Yes, I guess.
Okay. Is there anything else that you feel like will be helpful or to be one of the goals that lead our process?
Um, as I said, I'm actually not sure. I do feel like I need to find a better way to eating, which is the reason why I went to the nutritionist for the first time. Um, and then she told me that I could get use of this space as well.
Okay. So learning better eating habits.
Yes.
That's gonna be covered with the nutritionist. But then also there's an emotional, psychological part of that. And you mentioned before that sometimes with food, you use it to deal with stressful situations or with difficult situations that you're dealing with. So maybe looking at some of those situations and learning how to cope differently to them. Does it sound like something that maybe you could be interested into?
Yes, of course. Yes. Yes, I find that very useful. Yeah.
So I know you mentioned before that you didn't have like a clear idea, but it sounds like you have two. We're talking about eating habits and some of the things that can trigger some of the behaviors and how to cope differently to those situations. And then we're talking about like learning how to manage time. Does that sound right?
Yeah, sounds right.
Okay. So we definitely can start with that. And throughout the process, there may be other things that you want to look into or that you learn that you feel are important into this process. And I'm always I'm always welcoming into that, and we always can review that. But these two things that we just mentioned today could be our goals for the process and are going to be like the lead ideas that are going to help us move throughout it. How does that sound?
Sounds good. Yeah.
Mm. I wonder if you want to say something else today before we end our session.
No, I think that you have covered pretty much clearly than what I was even coming with. So I think it's a good start point.
Yeah. Okay. So we're going to stop here today. We discussed some of the things that are going to lead our process. And we talk about what brought you and what can come out of the process.